Oh, all right. Hi there, everyone. My name is Rundy Murphy. I'm an epidemiologist and the Director of Disease Surveillance at the Mobile County Health Department. Today is Monday, September 27th. I hope you all had a fabulous weekend. The weather was just phenomenal, so hope you got out and enjoyed that good weather and stayed safe from COVID while doing so. Today, we're reporting on 71,073 cases of COVID 19. 50 cases were reported to us yesterday. Yesterday, 3 additional deaths were reported. That brings the cumulative number of people who've died with COVID to 1,241. Yesterday, 9 people were hospitalized or diagnosed in the hospital with COVID 19, bringing the cumulative number of people hospitalized with COVID to 8,757. Yesterday, there were 124 people in mobile hospitals with COVID 19. So, it's looking good still, which is great news. Our weekly expanded report, we're reporting on just 778 cases reported last week, which is down from the previous week. So we have, except for that backlog of data that was dumped 3 weeks ago, we've had 6 straight weeks of reduction in the number of COVID cases reported to us. So that is really good news for our community, that the rampant transmission that we saw in July and August appears to be ending. We hope that maybe in another 10 to 14 days, we will be back to seeing the low number of cases, low double digits, hopefully single digits, that we saw in May and June. So this very record-breaking, very severe, very deadly COVID wave of our Delta wave of COVID-19 appears to be resolving. So I think that we are still seeing a lower number of hospitalizations. It is still in the hundreds, which I would really feel better if it was down in the lower double digits, but it is improving. 85% or so of hospitalizations are occurring in unvaccinated. About 90% of deaths are occurring in unvaccinated. The 20 deaths last week, 20 people died because of COVID-19. So that is a decrease, a weekly decrease. We've seen that decrease over the last 3 weeks. So hopefully this spike in the number of COVID deaths also will be getting back close to normal very soon. The percent of emergency department visits for COVID-like illness is low. It's down less than 4%. And the percent positive laboratory tests, so these are the percent of all laboratory tests that are COVID positive, is below 10% for the first time since early July. So that is really good news. So good job, everyone who's getting vaccinated, who's wearing masks, who's distancing. We are probably also to thank just sort of the normal biology of the pandemic or of this Delta wave, and that it appears that we are getting past it. So that does not mean that it's over. It does not mean that we're out of the woods. We are still seeing every day people dying with COVID, people getting hospitalized with COVID. And again, this is mostly unvaccinated. If everyone had been vaccinated, this Delta wave would have looked very different. We would have been able to avoid a lot of deaths. So it's just important that we continue to be vigilant, avoid gatherings if at all possible, particularly avoid indoor gatherings when you don't know the vaccination status of people in the setting. Just a comment on variants of concern. Still greater than 95% of COVID in Alabama are the Delta variant. CDC once again has changed the way they've added a new category of variants and have declassified some variants of interest or variants of concern. So right now, in Alabama, based on the new criteria, there have been in the last 4 weeks 36 variants of concern. All of those Delta and Mobile and other counties. Jefferson County is reporting 31, I mean, I'm sorry, let me start this over. 36 variants of concern, all of those Delta throughout the state. There are 0 variants of interest, and then 32 variants being monitored. This is the new category called a VBM, variants being monitored. So 32 of those were detected in the last 4 weeks, and those include Alpha, Beta, Gamma, Epsilon, Eta, Iota, Kappa, B1.617.3, Zeta, and Mu. So again, just a slight change, but mostly due to variants circulating that really are of no public health significance, and because of that, they're being declassified as variants of concern down to variants of interest, or further declassified to just a variant being monitored. All right, we haven't talked about breakthrough cases in a while. There have been around 30,000 documented breakthrough cases in Alabama. About 1% of those resulted in deaths. And remember, in people who've died with COVID, 90 to 91% of them are not vaccinated. And then again, we do see reinfection. So these are people who had documented laboratory confirmed COVID and then got it again. So there have been around 10,000 of those, also with about 1% of those dying. So, if you had COVID before, you could get it again. So please, please, please consider getting vaccinated to get the full measure of immunity to protect you from getting COVID, from transmitting COVID, but primarily for the 90 to 85 to 93% of the hospitalizations and deaths that will be prevented because you were vaccinated. We're also upon flu season, so we're recommending everyone 6 months or older get a flu shot. You can get that at the same time as you get a COVID vaccine. So please reach out and try to find a place to get vaccinated. I often give, there's been a slight change in the Mchd locations for walk-in COVID testing and walk-in COVID vaccination. Last week, our team gave out 423 COVID vaccines. 212 of those were third doses. So we'll talk more about third doses and boosters in a minute. The Mobile County Health Department tested about 860 people last week with about a 12% positivity. So I like to give those numbers. The change this week, and again, please make sure you visit mchdcares.com on the latest information about where we are giving vaccine and testing. And this week, due to some downward trend in demand and also some competing priorities going on in our clinic, we will not be providing vaccine and testing at our downtown Keeler location this week. So all of those activities have moved to our New Bern Health Center clinic at 248 Cox Street. Again, Monday through Friday, 9 to 7, Saturday, 10 to 4. We will 10 to 2 on Saturday. We reduced those hours last week. And also we are not open on Sunday. Again, just a reduced demand for testing and vaccination. If the demand goes up, then we will certainly change those hours. And I've mentioned before, we're still looking for a location to maybe a storefront location to try to make a sort of our permanent COVID clinic, but more news on that as we continue to look at properties and try to find the right spot. All right. If I had read that, I wouldn't have gotten it wrong, huh, Mark? Thank you. Okay, just wanted to comment on something I've seen in the news, that some school districts are lifting their school mandate, and the low transmission that we're experiencing right now is partly due to school mandates. So I just want to congratulate and thank all of the superintendents and the school boards and the local education authorities that are opting to keep the mask mandate in place. We really are thankful to you for, you know, doing what you can do to prevent COVID transmission, not just in your schools and your after school programs, but also in the community. So we are hoping to release some information. The CDC last Friday published a news release on a compilation of studies that show there are more COVID-19 cases in areas without school masking policies. So again, just highlighting the importance of using layered prevention strategies, including universal masking in schools to stop the spread and minimize disruptions to school operations, and to keep kids in school. In-person education is best for schools, and kids are safer and teachers are safer with universal mask mandates. So there were 3 studies, one from Arizona showing that schools in 2 of the state's most populous counties were 3.5 times more likely to have COVID outbreaks if they did not have a mask mandate compared to schools that did. Another found that during 2 weeks following the start of school, the average change in pediatric COVID cases was lower among counties with a mask requirement as compared to those without, about twice or about half as many, or twice as half, 50% lower, sorry, having a hard time getting that out today. And then a third report that looked at school closures and found that despite an estimated 1,800 school closures so far this year, 96% of schools have been able to remain open for full-time in-person learning by continuing to layer prevention guidelines like universal mask wearing. So these 3 studies and this information continues to show the importance and effectiveness of the guidance for COVID prevention in K through 12 schools, which includes universal mask wearing and other prevention measures like distancing, like strong isolation and quarantine protocols, like increasing ventilation, disinfecting surfaces, things of that nature. Dr. Eichel made a comment that, this data shows how important face coverings are in helping stem the spread of COVID-19, and he thanks the leadership of school officials in helping slow the transmission. So please, I know that we have gotten to very low transmission, but please don't make the mistake that we did after, in May and June, that when things started getting better, we just went back to normal, and then we ended up with this very deadly, very severe Delta wave of COVID-19. So please continue to use precaution. All right, there were some questions last week that I would like to address here. Last Thursday and Friday, we announced that the Mobile County Health Department is providing monoclonal antibody injections at our clinic on Dolphin Island Parkway. So Family Health decided to move those services elsewhere so that we could focus that clinic on providing treatment for people who get COVID that were unvaccinated. So that generated a couple of questions. One was, how long is the treatment? So the treatment and the evaluation can take about 60 minutes. It's a total of 4 subcutaneous injections. Next question, does one treatment work, or do patients need to get multiple doses? So it's 1 treatment, 4 injections at that 1 treatment. Is it free? Yes, it is free. No cost to the patient. We will collect information about your insurance if you are insured, and we'll ask to have a copy of your driver's license because we may be able to recoup an administrative fee for people who are insured or through some of the uninsured funds, but the treatment is at no cost to the patient. The next question was, how do people get a prescription to go to the health department? So you don't need a prescription. What you need to do is call 690-8889 to see if you're eligible. Treatment is provided under a standing order from Dr. Eichel. So you have to be within 10 days of a COVID positive test. If you're beyond 10 days, you're not eligible. If you've been vaccinated, you're not eligible. So call 690-8889 if you have recently been diagnosed with COVID and you are at risk of severe illness from COVID. So if you are immunocompromised or have underlying medical conditions, call 690-8889. They'll talk with you for a few minutes, make an appointment for you to be evaluated, and then that's usually, I think, a telehealth appointment. And then at evaluation, you can get the treatment there. So how often do providers request additional doses? Is it automatic or weekly or monthly? So the health department placed 2 orders for REGEN-COV, that's the monoclonal antibody that we have. We placed and received 2 orders before the manufacturers put the treatment on allocation, and we ordered it and received it before Health and Human Services changed the way they allocate to it going through the states. So the inventory that we have now was obtained before that happened. But providers now, to order more monoclonal antibodies, it has to be done on a weekly basis. The state health department sends the provider a link, a ReadyOps link. The provider requests the product and the number of doses that they would like, the number of treatments that they would like, and then the state decides based on how much is allocated to them by the vendors. The state decides what provider orders get filled and how much of that order gets filled. I know that right now they are only able to fill, I think, maybe a third to 50% of the orders that are placed weekly. All right, let's see. So again, just to address a Facebook question, you're not eligible for monoclonal antibody treatment if you've been vaccinated. We're trying to save that. The vaccine should help protect you from severe illness and death, and we want to save that monoclonal antibody treatment for people who are not vaccinated. Just to put it in perspective, we have almost a limitless supply of vaccine right now. I think the allocation each week for Alabama is less than 10,000 doses of the antibody. So there will never be enough antibody for everyone who would like to receive it. So please don't defer vaccination because you're counting on getting the antibody treatment, because that may not be available to you. Please get vaccinated. All right, people asking where the Pfizer booster is available. Mark, do you mind getting that JJPR flyer on the 4 categories of booster?
The May, and should, okay.
The 2 shoulds and the May, thank you. I think maybe that's the one I realized I was missing. Okay, we're going to talk about 3rd shots and booster doses in a second. Somebody's asking me, where in Mobile is the Pfizer booster available? So Pfizer is available at most pharmacies, and it is also available at the Mobile County Health Department. So you can come to our clinic at Cox Street to get Pfizer, Moderna, or J&J. And then if you'd rather have an appointment, you can call 690-8889. Most of our clinics have all 3 products, but a pharmacy would probably be your best bet for looking for a Pfizer 3rd dose or a Pfizer booster. And so let me talk a little bit about those 2 things because it is extremely confusing. So back in July, I think, I don't remember, previously, FDA authorized a 3rd dose of Moderna or Pfizer for people who are moderately to severely immunocompromised. So this is, thank you. So people of any age or 12 and above, so people 12 and above who are moderately or severely immunocompromised are eligible for a 3rd dose of Pfizer or Moderna. The 3rd dose should be taken not sooner than 28 days after your 2nd dose. So the 3rd dose is really part of what we call the primary series, right? So for me, I'm healthy. I got 2 doses in my primary series. I got a dose of Moderna one dose, and then 4 weeks later I got a second dose of Moderna. For me, that completes my primary series. For someone who is moderately or severely immunocompromised, you should get 3 doses of Pfizer or Moderna. So a dose, a second dose 3 or 4 weeks apart, depending on whether you got Pfizer or Moderna, and then 28 days later, a third dose of Pfizer and Moderna. That completes that primary series. So for me, primary series is 2 shots. For some people who are immunocompromised, their primary series may be 3 doses of Moderna or 3 doses of Pfizer. For people who got the J&J vaccine right now, 1 dose completes their primary series. Okay, so let's set third doses aside, and now let's talk about boosters. So on Friday, a booster dose was authorized for Pfizer only. A booster dose for these people, 65 and older, or residents of long-term care facilities, people 50 to 64 with underlying medical conditions. Those 2 people should get a booster 6 months after their primary series. So if you are 65 and older and you got Pfizer, you should get your your booster dose of Pfizer 6 months after completion of your primary series. So that's who should get a booster. 65 and over, long-term care residents, 50 to 64 with underlying medical conditions. Then those are the 2 shoulds, and there are 2 mays. We keep calling them the 4 bullets, the 2 shoulds and the 2 mays. People from 18 to 49, so adults with underlying medical conditions, may get a booster at 6 months. And if you are 18 to 64 and you're at increased risk of COVID transmission because of the work that you do, then you may get a booster dose 6 months after your primary series. All right, so 65 and over should, long-term care residents should, 50 to 64 with underlying medical conditions should, 18 to 49 with underlying medical conditions may, and 18 to 64 may if you work in a setting that puts you at risk of getting COVID. And we don't have a list of jobs anymore. So if you show up at our clinic and you say, I'm 20 and my job puts me at greater risk of getting COVID, you are eligible for a booster as long as your primary series of Pfizer was completed 6 months ago. Remember, the booster, only Pfizer, and not for anyone between the ages of 12 and 17. So I will pause there because to go on about it much more may just further confuse people. Are there any questions, Mark?
There's 2.
Okay, let me get these 2 questions.
Do you think that the flu season will be mild this year like last year?
So the question is, do I think seasonal influenza will be milder this year or as mild this year as it was last year? I believe the flu season is going to be worse this year. Last year, we had mask mandates, we had limits on occupancy, we had schools closed, and all of those things that were in place to prevent COVID transmission kept flu season very low. So this year, I'm not optimistic that we're going to have a mild flu season. I worry that it's going to be as bad as previous years or potentially even worse.
When you get the vaccine, is it true you can't donate plasma?
We have talked about this before, and I don't know the answer to that question. Check with the American Red Cross for questions about being able to donate blood after COVID or after getting vaccinated with COVID. Right, I think that's it. So we will see you again on Thursday. Thursday will be my last Facebook Live update for a while. The numbers are going down. I'm going to be on vacation next week. So Dr. Eichschild may pop on Facebook Live next week, next Monday at this time. So check in and to see. As always, we will continue to update the public through news releases, through our social media pages. You can always go to mchdcares.com to get the latest updates on where we are testing and vaccinating. So we will talk again on Thursday. Again, please, please, be glad that COVID transmission is reducing, is going down in our community. Be proud of the work that you have done to contribute to that. But please, let's don't backslide by lifting prevention measures or just thinking that it's over and we can go back to normal. It's not over. It's not going to be over for a while. People are still suffering very severe illnesses, hospitalizations, and deaths because of COVID-19. So wear your mask, get vaccinated, keep your distance from people that you don't know. We'll talk again on Thursday.